Thanks. There we go. Hey, everybody. Sorry for the delay. We had a little bit of a technical difficulty getting the Zoom started, but I think we are officially up and running. So we're going to just give folks another minute to filter in. Again, sorry for the delay here. And just sit tight. We'll get started in just 1 minute. Thank you for joining us. So again, for folks who just joined, apologies for the delay. We had a little technical issue, which has now been fixed. So we'll get started really shortly. So just sit tight and we will kick it off soon. Okay, I think we are actually good to go. We've got a good chunk of people who have filtered in. So Lydia, you can go ahead and stop sharing your screen here. And we are going to record this webinar. So just a heads up for everybody who's joined us, we're going to record this webinar so that we can use it afterwards and continue this discussion. But first, let me introduce myself. So my name is Matt Wellington. I'm the Public Health Campaigns Director for the U.S. PIRG Education Fund. We are a nonprofit, nonpartisan consumer advocacy group, and I am going to be moderating today's discussion. And we've been working for several years with our partners to reduce antibiotic use in agriculture. And primarily, we see antibiotic resistance, as do a lot of public health organizations and groups, as a really significant, one of the most significant public health threats that we face today, of course, in addition to COVID. And we know that the primary contributor to antibiotic resistance is overusing these drugs in any setting, whether that's in human medicine, in agriculture, anywhere. And so for today's discussion, we are going to dive into how the meat industry can reduce antibiotic use. And we're going to hear some examples of that from a couple folks, and how market forces can encourage those kinds of changes. And of course, what's at stake if we don't move quickly enough to take action on this front. So without further ado, let me introduce our panelists, and then we'll get into it here. So I'm joined by some very talented people with a lot of expertise in this issue. So first, I have Dr. Samir Patel. And Dr. Patel is an associate professor in the Department of Pediatrics, Division of Infectious Diseases at Northwestern University Feinberg School of Medicine. He is also the director of antimicrobial stewardship at the Ann and Robert H. Lurie Children's Hospital in Chicago. I also have Lydia Palumbo here, who's my colleague. Lydia is the Antibiotics Campaigns Associate with U.S. PIRG Education Fund, and she is working primarily to reduce antibiotic use in agriculture through corporate actions and policy solutions. And we've got John Tarpoff joining us as well. John is the Vice President of Beef at Nyman Ranch and Panorama Organic Grass-Fed Beef. And lastly, we've got Joseph Fisher, who's responsible for sales and customer management, including restaurants, retail stores, institutions, and distributor relationships for Fisher Farms, which is a 6th-generation family farm in Indiana. So thank you to our panelists for joining us. Really quick ground rules. So each panelist is going to give brief opening remarks so that we have plenty of time for discussion. And they'll share their perspective and experience on antibiotic resistance as it relates to farms or in human health. And then we will have our discussion. And when we get to the Q&A section, just a heads up for people, feel free to put your questions in the Q&A section of the webinar, and I will get those to the panelists. So without further ado, let me pass it to our first panelist, Dr. Samir Patel, who's going to give us a quick lay of the land on antibiotic resistance. So over to you, Dr. Patel.
All right, thank you, Matt. Like it was mentioned, I'm a pediatric infectious disease doctor here in Chicago at our Lurie Children's Hospital. I oversee the judicious use of antibiotics. I work with doctors in inpatient, outpatient settings to advocate for the judicious use of antibiotics, using antibiotics only when we need them to minimize the use or avoid use in situations where it's not indicated. And that involves a lot of collaboration with all types of healthcare providers. So I'll just give a little bit of primer on antibiotics and resistance and why it's important to healthcare. So antibiotics, for those who are not from medical care background, are a class of medications that are used to treat bacteria. And essentially, they're molecules or chemicals that that work on some part of metabolism of an organism that we don't share. So you can kill the bacteria with minimal effect harm to us. So now those organisms that are exposed to those antibiotics can develop resistance. So every living thing, when under evolutionary pressure, selection pressure, can adapt. And by creating situations where you're under antibiotic pressure, organisms that can emerge that are resistant to those antibiotics and then proliferate, because in that situation, there's an advantage to have resistance to that antibiotic, and then they can spread. Now, having antibiotics in our arsenal is instrumental to our modern healthcare system. So imagine all the common infections that we treated for, ear infections, urinary tract infections, but also our most vulnerable patients. Those are immunocompromised, those are having surgery. And it's very hard. It's hard for us to imagine a pre-antibiotic era where these drugs weren't there, but we should, because of the way that we're using antibiotics now, we're entering a post-antibiotic era where they won't longer work. So with antibiotics, unlike other classes of drugs, when we overuse them, most other medications, you may have side effects, or you may get better drugs over time that are more effective. But with antibiotics, they lose their effectiveness because of this issue of resistance. So any sort of policy, any sort of practice pattern that can use antibiotics only in situations you need them is beneficial to reduce the burden of resistance. Now, resistance has emerged throughout healthcare. So when we first developed antibiotics in the early 20th century, we saw resistance develop soon afterwards. Unfortunately, we are using antibiotics, we are using them and developing resistance faster than we can develop new ones. So in our healthcare system, in our communities, antibiotic-resistant organisms are increasing. They can spread from people to people, from our environment to us, soil, air, water. They can spread from animals to humans, from humans to animals. So we really have to approach the tackling of antibiotic resistance from all perspectives. So it really requires collaboration across all aspects of veterinary medicine, farms, in human medicine to really promote judicious antibiotic use. And one thing that we should learn from the COVID pandemic is that an infectious disease concern is everybody's problem. So it's not just contained to this particular hospital or this particular type of patients. Where we live in a very small world, and we know from experience that these resistant organisms can spread on planes and soil, from food, et cetera. So we really, as stewards of antibiotics, should really promote use that is judicious across all aspects of animal and human care. Thank you.
Thanks, Dr. Patel. I think one thing you said particularly resonates with me is, we're misusing the drugs faster than we can produce new ones, right? And that's something we harp on pretty often is, yeah, we need to produce new drugs, but if we don't stop the way we're overusing or misusing them, then we're not going to really solve this problem. We can't necessarily innovate our way out of this crisis. So thank you for that. So now I'm going to pass it to Lydia to talk about what PIRG is doing on this issue.
Yeah, thanks, Matt. Hi, everyone. My name is Lydia Palumbo, and I am an antibiotics campaign associate working with the U.S. PIRG Education Fund on antibiotic resistance. So as Dr. Patel just discussed, antibiotic resistance is a huge public health threat that is largely caused by the overuse of these medicines. And a significant amount of this overuse is taking place in the animal agriculture industry. So at PIRG, we're working to reduce the routine preventative use of medically important antibiotics in meat production. We think antibiotics should only be used to treat animals who have been diagnosed with an illness. 2/3 of the medically important antibiotics sold in the US go to the meat production industry every year. And many large-scale industrial farms, where much of the meat we eat comes from, will use these antibiotics routinely to prevent disease and to compensate for stressful, overcrowded living conditions. And this practice does cut production costs, but it also sacrifices public health. This overuse of antibiotics creates drug-resistant bacteria, or superbugs, which can spread from farms into communities and make people sick. And so today, I want to focus specifically on antibiotics used to raise cattle, because the beef industry actually accounts for 41% of all medically important antibiotics sold to the overall meat industry as of 2019. A 2020 NRDC report states that the US beef industry consumes these drugs 3 to 6 times more intensively than many of our European counterparts. And here, more intensively is referring to per kilogram of livestock. And the US does have some antibiotic regulations in place, but they're not nearly as effective as they could be in limiting antibiotic use. In 2017, drug sales in the meat industry dropped, which is probably due to new federal regulations that increased veterinary oversight, as well as some other market actions. But after this initial 2017 drop, sales of medically important antibiotics rose consistently for 2 years in a row. And although the FDA has outlawed using antibiotics solely to promote growth, the agency continues to sanction the widespread use of medically important antibiotics to prevent disease. And so as long as that practice continues, we're going to struggle to meaningfully reduce antibiotic use in beef production. At Purg Education Fund, we've been urging major meat buyers to use their purchasing power to create change around antibiotic use. And this has been really successful in chicken production. According to an industry survey, only 1% of broiler producers in 2020 used full spectrum antibiotics. The change in beef has been slower, but the good news is there are several buyers that are already sourcing beef raised without routine antibiotic use, including Panera, Chipotle, Shake Shack, and BurgerFi. And there are several other fast food companies that have made significant commitments to reduce antibiotic use in beef, but just haven't followed through on these commitments quite yet. The Sixth Chain Reaction Report, which is a coalition effort that essentially grades major companies on their antibiotic use, details this industry progress. So here are a few updates. In 2015, Subway made a commitment to eliminate preventative use of medically important antibiotics across all of its meat supplies by 2025. In 2019, Taco Bell announced a new pledge to cut the use of medically important antibiotics in its beef supplies by 25% by 2025. And unfortunately, the company has not reported any progress on this pledge since it was made. And a major improvement recently came from Wendy's, who is the third largest burger chain in the whole country. And they committed to prohibiting the routine use of medically important antibiotics in their beef supply by the end of 2030. As far as we know, McDonald's has unfortunately failed to meet its 2018 commitment to establish antibiotic use reduction targets across much of their global beef supply by the end of 2020. And as the world's largest beef buyer, this inaction is really sending the wrong message to the industry. So we're hoping that McDonald's will move quickly to fulfill their commitment. At US Purg Education Fund, we want to preserve antibiotics for the health and the safety of future generations. And in order to do that, we need to reduce use in human medicine, but also in meat production. So I'm really excited to hear from our next two panelists about how they've done that in their own practices. Thank you.
Yeah. Thank you, Lydia. And I think the chicken production stat you mentioned is really, really compelling, right? So only 1% of broiler producers in 2020 were using full spectrum antibiotics, meaning the full arsenal of drugs available to them, and everybody else was either on reduced use programs or not using any antibiotics at all. So as Lydia mentioned, we've got some movement in the beef industry to really start shifting practices. And so I want to pass it over to John, who is very much in this space and can share some of his experience with Nyman Ranch in raising their animals in a new way that doesn't overuse antibiotics. So John, I'll pass it over to you.
Thank you, Matt. Just a few things. As Lydia had mentioned, the Veterinary Feed Directive, which passed in 2017, has had a couple of different parts to it. And what it first and foremost was, cattle producers could no longer use antibiotics as a growth promotant in the feed. That by itself lowered the use of antibiotics about 30%. Now, again, as Lydia said, since then it's gone up some. What kicks in part of that agreement next year is the over-the-counter injectables that the beef industry has been able to use, things like Tylenol, tetracycline, penicillin. Those will no longer be able to use without veterinary directive. So that again should knock down some of the overuse of antibiotics. The first was a good first step. This will be a good second step. There's ways that needs to go. First and foremost, if an animal gets sick, you have to treat it. That's the humane thing to do. You can't just leave it go. That being said, a couple of things. If you give an animal an implant, which is an added hormones, you actually detract from the quality of the meat. Again, if you have to treat an animal with antibiotics, the meat never reaches its genetic potential. So those two things alone will show how the industry is kind of shooting itself in the foot when they use both implants and antibiotics. The old model is volume in, volume out as economically as possible. What we do as Niman Ranch, we changed it. We wean later, we slow down the feeding process. By doing that, you minimize stress. Working closely with Dr. Temple Grandin, she called and said, I love what you're doing, let me help you make it better. So working directly with her, she proved to me that where we were working very hard on genetics and nutrition, the animal husbandry, minimizing stress is just as important for that animal as the other two things. So it's very interesting. You've got your genetics, you've got your nutrition, and you have the animal husbandry. We refer to it as a three-legged stool. And that's how we are able to come up with one of the premier quality products in the country. Again, it's a different way of doing things. You have to change the model to make it work. When I came into Niman Ranch over 15 years ago, within the industry to do natural beef, it was normal to have 10 to 15% kickouts that you would have to actually treat. Now with our producers, by following a different model and doing things differently, it's less than 1%. It all gets back to economics. To do things our way, it costs more money. So we have to find the consumers that are willing to pay more to get something a little bit different. The consumers in the long run are the ones that dictate what the industry actually does. If they want more antibiotic-free product, the industry will have to change the direction they're doing and make it work. We've shown that by using our methodology, it does work. Thank you, Matt.
Thank you, John. Yeah, I mean, I just want to reemphasize what you said about the 10 to 15% of the old model or the conventional model, I guess, having to treat sick animals or use antibiotic use in some way. Your model, it's less than 1% of animals that need antibiotics. And that's through the combination you mentioned, genetics, animal husbandry. I think that's just worth re-emphasizing for people that if you change the system, if you raise the animals in a better way, you don't need to use antibiotics. So with that, I want to pass it to Joseph. And one of the things John said is the consumer has an incredible amount of power. So Joseph, you're dealing with people who are buying directly from your farm. So I'd love to hear what the experience is like dealing with buyers and what Fisher Farms is doing with its antibiotic use practices and how you communicate that to meat buyers who are looking for that kind of product.
Yes, thank you, Matt. So as Matt mentioned, we are a family farm, so sixth generation, and I am that sixth generation. So our farm's been in the family since the Civil War, but really in about 2002 is when actually my dad, the fifth generation, came back to the farm, and we really looked at our processes and tried to figure out, how are we going to produce better beef on our farm? We saw what was going on in what we refer to as the conventional market, some of the overcrowding, a lot of the things that John mentioned as contributing to, what can we do to lower that cost, but at the expense of quality. So reduced quality, reduced health of the animals, and everything that goes along with that. It really just didn't sit well with us, both on the raising side, but also on the processing, on the butchering side as well. And so we started to revamp our processes on our farm to produce natural beef. So natural beef to us is not using growth promotants. It's not using routine use of antibiotics, treating them, as John mentioned, when they are sick, but really taking that out of the normal day-to-day processes. But then also on the butchering side, we're not adding anything to that meat. So it's just good, clean meat, kind of from start to finish. But when you take out those antibiotics from the routine usage, you have to reduce the opportunities for sickness. So when you're giving them those routine antibiotics, you can overcrowd, you can overfeed, you can use those growth promotants. You don't have to worry about as much of those things that we consider just humane treatment of cattle. And so we implemented things like, our barns are all open air. So if they ever are in barns, it's dry, very open air, lots of space barns. We use the sandhill calving method, which groups calves by their age. Then, the list goes on, but you get the idea that you have to implement different processes on your farm that ultimately enable your cows to stay healthier without the intervention of antibiotics. And, we, as John mentioned, we treat our cattle if they are sick. We keep a close eye on them, but it's, very similar numbers to what the Nyman Ranch folks have as well on actually intervention when we have to pull them out of the herd. And so as we started doing this, we shortly realized that at that point, which is about 15, 20 years ago, there weren't very many buyers that were willing to offer a premium price for those calves. So we're producing better quality beef in a natural way. The consumer should want that, but the big buyers weren't necessarily willing to pay that. And so that's when we started selling directly to customers in our area, both on the wholesale front, but also direct to individuals as well. And so we've grown, and we now supply everything from smaller retail stores to Big Ten university dining courts. And what we hear is, everybody buys natural meat, potentially for somewhat different reasons, but it's really all about knowing what is in your meat. What does the end customer care about? And it's that trust. Folks have trust in the Nyman Ranch and the Fisher Farms models because they know exactly where that meat's coming from. And that's really what we're going for. And we have our 5 pillars that we focus on of being premium. So we want that meat to not just be natural, but also taste really good. The natural component, which includes not only the antibiotic side, but also how the meat is butchered as well. It's local, it's fresh, and it's also sustainable. So, and when we're talking to customers, it's really an attack from all fronts kind of methodology where, different consumers are going to hear things in different ways, and they're going to respond to things in different ways. So it's everything from social media to signage to customer handouts to videos to more of the train the trainer model where you're actually talking to distributors, you're talking to the chefs that are actually using your products so that they understand, we're using this meat and we're proud to use this meat and here's why. And their customers can then take that with them. And it's a long way of saying we really have to attack this from all fronts so that we can really get that message across.
Awesome. Thank you, Joseph. So we're starting to get a couple questions in the Q&A, and this is the time where I'll just flag for attendees. Feel free to start putting your questions into the Q&A function, and I'm going to start working those into our discussion here. And actually, our first one is about preventative antibiotic use and how that will eventually, hopefully, be reduced. So the question is, do panelists think that the FDA will place restrictions on it? So, John, you mentioned earlier, there's been a couple of moves forward from the FDA, but still a long ways to go. So will FDA place restrictions on that, or is it more likely that we'll see states taking the initiative, as Maryland and California have done, or will change ultimately be driven by consumers? We've heard a couple times that consumers have an immense amount of power here. So I'll open that up to all of the panelists, and let's have Lydia go first. How about that?
Yeah, thanks, Matt. I think at PERG, we really do focus a lot on consumer power. We like to emphasize how much, as John mentioned, how it really is in the consumer's power to dictate what the industry does. And I think we've also seen a lot of progress on that front already, just looking at Wendy's, as I mentioned. they recently committed to stop sourcing any meat raised with routine use of medically important antibiotics by the end of 2030. And that was largely due to consumer pressure. They listened to what their consumers were asking for and kind of followed through. And also just looking at the overall fast food market, having moved almost entirely away from raising chicken with the use of medically important antibiotics, was also in large part due to listening to consumer opinion. And at PERG, I think we also are hoping to see more changes in states like Maryland and California. We were instrumental in passing those.
Yeah. So I think consumer-driven change probably in the short term, and it sounds like from what you're saying, Lydia, and from what I know of our work, we would love to see policy change, but that's probably going to be a long-term thing. But how about you, John? What do you think about that?
I think first and foremost, right now, the definition of natural is being misused. Under USDA, natural is no added hormones and no added ingredients. I mean, my God, it pretty much a lot of product in the US would qualify as natural. What has to start first and foremost for the consumer. So when they eat something that they think is natural, like from Fisher Farms or from Nyman, that they're expecting it to be hormone-free and antibiotic-free. Well, unfortunately, within the industry, there's a misuse of the term, and it's not so. So first and foremost, have USDA come up with a legitimate definition of what natural really is to get rid of the phonies, and then work with FDA. Like I said, there's a couple of different steps within the Veterinary Feed Directive. First one was done and that helped. The injectable part now that's coming up is going to help more. It's a good start. You have to have the antibiotics available when an animal gets sick, but you don't want to use them, you don't want to overuse them, put it that way.
Right. I think that's a really good point. And I was hoping to talk about the labeling because I think it's important for consumers, like you said, to be able to verify the claims being made. Like I know, Joseph, I'll pass it to you in a sec. You're talking directly to your buyer, so you can convey some of that. Consumers in the grocery store, they don't have that luxury of being able to talk directly to the farmer, right? So, thank you for bringing up the labeling, John. And I would just say I know there can be some issues with producers who are using medically important antibiotics to treat sick animals, and they don't have the no antibiotics ever label to use because they're not fitting into that. They want to treat sick animals with medically important antibiotics. I would just give a plug to the Certified Responsible Antibiotic Use Standard, which has been developed by our friends over at the Antibiotic Resistance Action Center at George Washington University, I think also in collaboration with NRDC. And that is a verified label that producers can use. But yeah, thank you for bringing that up, John. It's an important step. So Joseph, what do you think?
Yeah, and I'll kind of build on that too. Consumers in grocery stores especially in the meat aisle, are given a lot of terms that they generally are familiar with, but may not totally understand. And I've even spoken at culinary classes, for 15, 20 minutes, just giving the very brief overview of this is what prime choice select means. This is what natural grass-fed organic means. The list goes on and on. And so, as John mentioned, there's just a lot of kind of confusion on what exactly those terms mean, both to the consumer, but also on the back end of, what the FDA and USDA classify those meats as. So I agree. I think just the terminology and labeling is very important. From our side of things, we label, I honestly think we could probably do more in making that even more clear to the end customer on that label, but there's a lot of information you're trying to get across to that customer too in a short amount of time with a customer that has a short attention span. They're worried about dinner. They got 3 hungry kids at home, and maybe they're not as concerned about the long-term ramifications of, what that meat is that they're purchasing and, what's just on sale that week. So it's the amount of time that you get in front of that customer. And so from our side of things, we do a lot of wholesale sales. So the label in those instances isn't quite as important as necessarily to the end in the retail standpoint. So in those scenarios, we're talking to the customer, explaining the whole what goes into that meat, if you will. But I think on the labeling side of things, I think, as you mentioned, using that clarity, getting that clear in front of the consumer, but then also it just takes reps. It takes kind of attacking them from multiple fronts so that they really understand what to look for, what they're seeing, and then ultimately what that means for them personally.
Right. Yeah. And I'll just say I've been working on this issue for 6 years. Even when I'm in the grocery store, I have kind of a hard time navigating the labels. So let me pass it to Dr. Patel. So Dr. Patel, you've been doing this work alongside us for several years. So what do you think about that question? Do you think the FDA will take action soon? Do you think it's more likely in the States or consumers? What do you think?
I think the real area of progress is with the consumers. I think that there are a lot of competing interests with and other priorities on the federal regulation. I think the state environments are variable. When I talk to families about resistance, it's usually in the context of parents asking about whether the child needs an antibiotic, or questions if their child already has had a resistant infection and how it happened. And there's a general sense of, if they've already had the infection, of being upset, and they want their child to be better as expected from a parent. And for the questions about antibiotics in general, whether the child needs it or not, they're very, I always have to defer to the expertise of medical professionals who are taking care of their children. But what I do see is that parents, families, patients want to do the right thing for their health. And it really echoes the importance of the labeling point that you mentioned. Is that they have limited options with choosing antibiotics for their children for medical purposes because they're the ones prescribing it. But as consumers, they have many options, and having interventions that empower them to make choices that are informed will be very, very fruitful because they want to do the right thing for their children's health.
Right. And so I want to also just make a connection here between healthcare settings. I think there's a lot of health professionals on the line. And so we've gotten some questions about how do you educate people. One way you can do that, I'll say, is in the hospital itself with the cafeterias. So approaching your administrators and asking them to start sourcing meat in their cafeterias that's raised without overusing antibiotics. And quick shout out to the Children's Hospital of Philadelphia, who has just done this. So we have a colleague, Talene, who was able to make that happen. And now the cafeteria at CHOP is sourcing and has committed to source meat raised without overusing medically important antibiotics. So that's another way that major meat buyers can drive change, and healthcare professionals can be very much in that debate. So we've gotten a couple of questions here about the difference between conventional agriculture versus, Nyman Ranch's model or Fisher Farms's model. Can you walk us through, this is directed at John and Joseph to weigh in. Can you walk us through the conventional cattle production system? What are the pressure points where routine antibiotic use is most common? Like I know, for example, diets has something to do with that. If the cattle are eating, diets that they're not necessarily evolved to eat, they can get sick. And so conventional producers use antibiotics to help prevent that. So can you walk us through what are the pressure points in the conventional industry? And then how do you think that conventional producers can change that based on your experiences? So who wants to start, Joseph or John?
I'll go.
Yeah.
All right. As I mentioned earlier, the conventional industry is set up on volume in, volume out as quickly as possible and as cheap as you can possibly do it. The most stressful time on an animal's life is when that calf is weaned away from its mother. So if it's set up to where they're going to wean anywhere from 3 to 6 months of age, that's going to be the most stressful time. When does an animal get sick? When it's put under undue stress. So a lot of times antibiotics have to be used during the weaning process. When I mentioned what we do at Nyman is wean later, By the time they're 7, 8, 9 months old and you wean them, they actually self-wean. Either that or the mother kicks them away. So it's less stressful than if you forcibly remove them from their mother at an early age. What that also does is it gives the immune system time to kick in. The animals are healthier to where you actually put them on feed, they don't get sick. So you look at, the stress points in an animal's life, those are the times where, in all likelihood, they're going to get sick. So the time that they're removed from their mother, the time that if possibly they're removed from their group, that is another stressful situation. The time when whatever they're eating is changed, that's another stressful situation. And then overcrowding. One thing that I'm really forcing with our ranchers is cleanliness. I want to be able to walk through the feedlot. You look at normal feedlots and you look at ours, and it's like, wait a minute, yours isn't a feedlot. I can walk through without getting any manure on my boots. They're kept that clean. You minimize the manure buildup, the mud buildup, and you take some of the stress away. You take the stress away, you don't have to use antibiotics. It's not rocket science, but it is a different methodology that you have to accept and incorporate to where you can end up doing that. Joseph?
Yeah.
Yeah, to build on those, overcrowding is generally one of the bigger ones, where they're giving, it's the FDA says you can't use it for growth promotion, but if you're using it for disease prevention, it's still okay. So when you're giving that in the feed, in the water, and they're overcrowded in those conditions, you're still kind of, it's still kind of in the same vein, I guess. And so giving them more space, making sure they're very dry, those types of things are incredibly critical to that. Especially if they're they can use these very high energy diets to fatten those cattle up very quickly. And, that generally results in liver abscesses and things in animals. And you can use antibiotics and other medications to reduce the amount of animals that suffer from those illnesses. So that kind of while they're in the barns, while they're out in the fields, another example is like there's a antibiotic that's put in the mineral, which is kind of a vitamin for cattle out in the fields that prevents pink eye. Pink eye is a disease that can actually blind cattle. We don't think about it too much on the human side of things, but in cattle, it's a pretty serious issue. And so we've done things where, obviously we take that out, but we also make sure that they're have plenty of nutrients during that time to fight off those diseases. And we also actually mix in a little garlic as well. Did I drop off? Oh, sorry. So we mix in like garlic with that, which helps kind of keep flies away and things. And so there's just a lot of different components. Another example would be potentially like traveling. If those cattle are traveling very long distances, a lot of times they'll give antibiotics beforehand so that they don't get the lung diseases on those long journeys as well.
A little bit of garlic in there, a little salt and pepper. Oh man. So I actually want to pass it over to Dr. Patel now, because you've both talked about the key points where antibiotic use is prevalent in conventional beef production. I also want to note there was a study, I think it was published, I'm just going to pull it up so I don't misstate it, but a study published in November 2020 showed that beef cattle on 22 feed yards in the US were treated with macrolide antibiotics for an average of 135 consecutive days. So I think that is typically used to prevent or treat liver abscesses in cattle, which, as you mentioned, is coming from the diets, the inappropriate diets. So Dr. Patel, what's your reaction to that? Like, how does that spur antibiotic resistance? That kind of, 135 consecutive days of using a macrolide antibiotic, which I think is maybe a medically important antibiotic, but you can correct me if I'm wrong. Yeah.
Yeah, it's one of our important antibiotic classes. I wouldn't say it's like one of our top categories of use, but it's one of our important. Those antibiotics are used to treat certain types of pneumonia. It's important for patients who may have infections with that class of antibiotics who infectious organisms that are like cousins of tuberculosis, a class of organisms that particularly important for certain patient populations. We care about having specific antibiotic classes be available in human medicine, because sometimes we will see patients who have multi-drug resistance, class resistance. So preserving treatment classes, and not just in macrolides, but in other classes of antibiotics they're used in animal medicine, like sulfonamides and tetracyclines, is important for us to to preserve these options. I was reviewing data from our surveillance that we do of salmonella isolates in retail chickens, and like almost 15% of them were found resistance to 4 different antibiotic classes, stuff that you buy in the grocery store. So just knowing that that we're using antibiotics that long for medically important antibiotic drug classes is concerning, because we've definitely seen that crossover into human medicine.
And then I want to stick with you for a sec, because I'm curious from your own experience, what has it been like for you when you first started practicing medicine in infectious disease to now? How has antibiotic resistance worsened? You said earlier that it's worsening, but like your experience, what has that been like for you? What have you seen?
Well, I would say that even in my own career, starting out when my training in the early 2000s, that having a particular type of organism, gram negatives, which E. coli is one of them, for example. Having a multi-drug resistant organism in someone who was just in the community, had no other risk factors, wasn't having surgery, wasn't getting a lot of antibiotics, was uncommon. Seeing in children having those multi-drug resistant organisms was uncommon. It's not so uncommon anymore. So we see patients who are in the community who get these infections and we don't know where they're getting them from. We see people who, there are studies that have shown colonization in babies and in mothers where no one's received any antibiotics. So we know that it can be present in soil and water and sewage. So I think just for this particular class of organisms for which we see the most serious resistance, we see increasing trends. Now, that's particularly important to save antibiotic classes for these organisms, because we often are in situations where when we're treating these patients, we're down to 1 or 2 options. It's not something that we see every day, thankfully, but it's common enough that we have seen children die from resistant infections that we have very, very limited options for, and we've seen even terrible situations where people have died from resistant infections, but had survived cancer, or were surviving cancer but died from resistant infections. So just that sense of public health threat is very tangible.
And thank you for sharing that. So we've gotten a question about education in schools, but also any talk of programs to incentivize schools and other institutions, so government incentives or subsidies to help schools and other large volume meat consuming settings afford to buy meat raised without overusing antibiotics. I know of one, but I'm curious if the panelists have any thoughts on that. If there's talk of that, if you know of programs, I'll just open it up to see who wants to answer that.
A lot of schools, colleges, universities, and actually high schools, particularly private high schools, seem to have, as part of in the last 5 years, and part of their sourcing, a certain percentage, and it seems like that percentage, originally it was 2 or 3% of the food that was sourced had to be natural, and then 5%, and then 8%, And then it became, they left 8% as natural and 2% organic, to where, and I think that's from, again, from the demand of the consumers are wanting, a combination of them wanting more products that, for lack of a better term, are cleaner. And then at the same time, within the school itself, the realization that, geez, you know, we can be part of the solution or we can be part of the problem. And so, again, there's an economic factor that goes along with it. What they'd like to do and what they can do probably don't even out all the time, but it's a start. It's a move in the right direction.
Right. Anybody else want to weigh in on this? And I can share the one thought I have.
Similar from what we've heard, not really incentive programs, especially from government agencies. It's kind of like more as John mentioned, it's kind of that pressure from students a lot of times, from parents a lot of times, is really driving change in those specific institutions. And then they can turn around and use that as a marketing component. So it's maybe how that food service, you know, if they outsource their food service, it's how that food service company is winning the business of that university or of that high school, is they're able to promote, hey, we're going to use 25% of all natural, no growth hormone, no antibiotic meat. So that's really where we're seeing it more, and less on, you know, there's this program or this incentive out there.
Gotcha. Yeah. So the one program I was going to mention, I don't know if it fits exactly into the question that was asked, but cadefarms.org is a good place to check out this program. They have a farm to institution program. So they're working to actually just check the attendees list to see if the person running it is on here. I don't know if he is, but they're working to connect local farms who have good practices to schools in New York State. So it's cadefarms.org if folks want to check that out. And that stands for the Center for Agricultural Development and Entrepreneurship. So I have another question in here to go back to Joseph and John. You're very popular today. So question about feeding your cattle. So the couple questions involve, I mean, just what do you feed your cattle? So grass-fed versus the conventional diet, what's the difference there? You know, do you feed your cattle soy corn, something other than grass? And if so, why? So I'll open it up to the two of you to answer that.
I can go first. So our cattle are, you know, raise them at, you know, different stages of their life. They're in different locations on our farm, but, you know, they're out on pasture. And then we have these, what we call as feed huts, which are basically just lean-to buildings that kind of keep the feed dry, where they can come into and eat a diet that we make on our farm. It has corn silage in it, which is chopped up corn stalks raised on our farm, that kind of keeps that nutritional value, and then we can feed that back out to the cattle. It's got some distillers grains in it, some straw, kind of a variety of kind of things that we feed in addition to all the pasture that they're getting. And the reason we do that on our farm is to get that marbling in the meat, the kind of stuff that we think makes it taste good and what our customers are looking for when they're serving it at a restaurant. And so that's why we do raise cattle the way we do, but it's still not that very, very high grain heavy diet that you see at some of the bigger feedlots, because they're really trying to get them to grow as fast as possible. So we're still growing them. We want them to grow at least 2 pounds per day their entire life. So really that constant growth that results in good tasty meat, but also does it in a healthy, natural way.
Yeah, John, over to you.
And I'll give you a couple of different scenarios with Panorama. It's organic grass-fed. So everything that they consume has to be organic, and a whole host of different kinds of grasses. With Nyman's a different kind of program, much higher quality. Just put it in perspective, industry average right now is about 8% prime. For the year, we'll run 40% prime. So it's a very high quality program. What we do is, while the cattle are on grass, we, similar to what Joseph was talking about, we call it creep feeding, where you give them access to some type of grain to get them used to when they actually go on feed, then where they can, their system can take it better. You can't go on a straight grain diet, as different people mentioned earlier. That's where you have liver issues and abscess and stuff. So you actually have to have enough roughage in the diet to protect the digestive system. And our cattle that are on feed will probably go through 5 different rations the whole time they're in feed. So starting off with, and what we have to do, comparable with Joseph's talking about, is you have enough energy level in the ration to where the cattle keeps growing the whole time and gaining, to where you don't have peaks and valleys. It's a constant gain while they're on feed. At the same time, being very conscious of the, your liver especially, but the gut and the kidneys, to make sure that you're not having any issues. So internal health is huge, and you've got to develop the ration based on internal health.
Gotcha. Thank you to you both. So I have a question for Lydia. So this topic is kind of complicated, right? I mean, we talk about antibiotic resistance, then we're connecting it to the farm. You're communicating with the public at large about this. So what are some of the challenges in communicating with consumers about this issue so that they immediately understand it and immediately know, okay, this is a problem, we can solve it doing this? What are the challenges, and what's your experience been like so far working through those?
Yeah, great question. I think one of the big challenges that I've seen so far is actually convincing people that they do have some power to make a change in this issue. Like, I think when we're going up against these really big industries like the meat industry, it's very daunting, and it doesn't really seem like the individual person can really do much about it. So at PERG, we try to really emphasize the progress that has already been made that I touched on a little bit. Yeah, so just kind of convincing people that they do have more power and agency than they might realize. And then I think another thing, which John and Joseph also both talked about, is kind of addressing unclear terms surrounding antibiotic use and resistance. Like one I keep running into is antibiotic-free meat, which is, I'm sure, like an easy marketing term to use, but it's really important that we verify that the animals are actually being raised without the drugs, in addition to the final meat product being free of residual antibiotics. So, it's important to try to be as clear and consistent as possible in the language that we use in public communication around this issue.
Yeah, and you inadvertently kind of answered another question we have from the audience about, whether the problem is residual antibiotics in the meat or whatever it might be. And so, just to emphasize, we're concerned about overusing antibiotics on the farms because that breeds drug-resistant bacteria that can pass off the farms, get to people, and make us sick. So there are protocols in place, there are laws in place to make sure that there's no antibiotic residues in the meat, or certain levels of antibiotic residues in the meat by the time they're sold. Okay, so we're at 4 minutes till the end of this. So I actually want to stop here because I want to make sure our panelists have a chance to give their takeaways to the audience. So I asked folks if they could think about what are the 3 takeaways you want people to come away with today. And so I'll pass it to Dr. Patel to give his 3 quick takeaways, if you can.
Just to remember that antibiotic resistance is a major global health threat, that it can affect us in our own communities, and that as physicians, we have a role to encourage our patients and their families to be judicious consumers.
Awesome. Thank you. And how about you, Lydia?
Yeah. I think the first one is that it's really important to make sure that these major meat buyers follow through on their commitments to reduce antibiotic use. I think there's been a lot of commitments made and not a lot of action behind those words. And secondly, which we've talked about a lot in this webinar, is that individual consumers do have a lot of power and agency to make change on this issue. And then just thirdly, I think it's really important to get the word out about antibiotic resistance as much as possible, especially because this is such a huge public health threat and it isn't really widely prioritized or advertised as such. So I think just creating conversation around antibiotic resistance is a really important step in moving forward.
Right. Thank you. And Joseph, how about you?
Sure. Yeah. So I think ultimately it's, it comes down to where's the pressure coming from, and then ultimately where are the incentives at. So if it's from the consumers, asking more questions, demanding more clarity from where their meat comes from, and that is both at the grocery store and in restaurants and cafeterias and things. And then on the incentive side of things, for producers, especially anybody that is selling to a big buyer, it really comes down to what are they looking for? What are they asking for? And a super quick story is, whenever we've started trying to sell to a big buyer early on, instead of selling direct to the customer, we asked for kind of constructive feedback on what are you looking for in beef that you want to buy. And he said, I'll never forget this. He pointed at my dad's chest and said, "You don't worry about any of that. You just focus on giving me the biggest calf you can." And that's always just kind of stuck with us, is kind of like, the incentives aren't in the right place then. And so you take that home, and if you don't have an outlet for a little bit more premium on that product, it's very difficult when you have bills to pay to implement different farming practices on your farm. And so the incentives will forever drive that industry until things change it downstream.
Right. Yeah. And John.
The first and foremost, the quality doesn't have to be sacrificed when you get into getting natural or organic. We've proven that, if anything, the quality goes up. We're very proud of what we produce, and if you talk to some of the very high-end restaurants, they'll tell you our product's the best in the world, whether it's beef, pork, lamb, all the above. Secondly, the consumer has a lot more power than what they realize. If enough consumers create the demand and go to whatever it is and say, "Hey, I'd like this product," they're going to get it. It's, economics is huge, especially now coming off of COVID. The demand within whether it's a grocery store, butcher shop, restaurant, the consumer has a lot of power. And thirdly, keep in mind, part of sustainability is economic sustainability. When you're asking that farmer or rancher to change the model, to change what they're doing to produce a better product, it's going to cost more. And so the idea is, well, I want all the above and I want it cheaper. It's not going to happen. It doesn't work that way. So keep that in mind. As you want a better, cleaner product, you have to be willing to realize it's going to cost more to get it.
Right. And I'll just close this out by saying, we at U.S. Pig Education Fund, of course, we're trying to address this health threat. And we firmly believe that, we should not be misusing life-saving medicines to prop up this model of production when we clearly have alternatives, as John and Joseph have showed. And, as Dr. Patel and Lydia have talked about, what's at stake if we don't do that quickly. So we'll close out today. And thank you so much to our panelists and for everybody who joined, and have a good rest of the day. Thank you all. Bye.